media for that. That was quite interesting. I know when we started this fellowship, we were quite a number of participants through time. I know it was so engaging. It was not easy because of, every week Friday we're having that session. And I need really to appreciate also the facilitators who really engaged in this fellowship program for providing their service. But I know we have at least 5 more weeks to go, and we'll be every week we'll be reflecting. I'll be asking the same question to each one of you as we move on. Maybe now what we'll do today, or today's task, is just to listen to your progress report. I can say hand. Dr. Banita, do you have a question? Or is it an old hand? Okay, great.
No.
Okay, wonderful. So today what we'll do is I will be listening to your progress report, and at the same time this session I'll be airing it also on YouTube live, so that we will be calling out an advert for the second cohort of the same fellowship, maybe to start sometime in April. And I need to encourage young peoples in the science space, young ones in medicine, in pharmacy, to consider to build their skill in computer drug discovery. The future of drug discovery, as you have seen, is computers. Now, artificial intelligence is coming. We have seen like AlphaFold predicting protein structure. Protein structure, for years it used to take like months to get, or not months, even years. Some scientists used to tell us taking like between 5 to 7 years sometimes to predict the structure of a protein. But now, if we know the cause of a certain disease to be a certain genome, a certain protein, then using some wet lab techniques and artificial intelligence, now we can be able to predict the structure of a protein, the structure of that genome. Imagine if you know the structure of your protein, the structure of the genome, then it will be very easy to get a potential drug that could bind to that target. And at the heart of computational research, what we talked is on which is embedded on the main dogma of pharmacology. That is, drugs bind with their target, could be protein, could be enzyme, could be genome, to produce a biological effect. That is a big dogma. So we need two things to know: drug, the molecule, that is a chemical, then the target, that is a receptor. You see, so what computational techniques are doing is they are helping us to predict whether whether the potential chemical can bind, can fit into that target. So there is also a lot on top of the binding, even predicting side effects, predicting bioavailability, predicting toxicity. All that we have covered in this journey. So I believe others listening to my voice this morning will be interested, will be so motivated to look for our next call. Just make sure you be keen. Stay watching. We'll be sending that advert, but this time we need very committed people, especially young ones who have really started their master's thesis or PhD thesis, and we are ready also to put computational research questions on their research project. If not, as we have done also in this cohort, it's also open for undergraduates, and I know some of you have got the benefit. I don't know if there is some of my students here, like a very interesting student I can mention here is like, I don't know if Tamara has joined. You see, she's an undergrad student, but she's really persisted in this whole program, balancing her class work and with this intensive program. And I wish this morning, if we appreciate those university students doing undergrad and who are also being committed in all this journey, were not dropped out. Quite a number of people have not managed and they were dropped out, and we really appreciate you. I think the coming weeks, every week, we need to reflect, at least give the first 15, 20 minutes to reflect. How was it? What is the good thing we did? Where can we improve? And so that we welcome the second cohort of peoples in this space. And I believe a number of you will take part either in facilitating the trainings, either in mentoring others, maybe again in joining the next cohorts, maybe when they write their research manuscript in such a way. I believe we can build the future of Africa. Remember, the future of Africa is in our hand, it's not on anyone's hand. We should not really look for help to come from other place. And we have that solution. We have the ability to solve not only Africa, because here we have peoples like Dr. Banita from India. So these developing countries have the big hope in translating research and in really solving quite a number of health problems. Good. Let me not talk much, but I'll invite the first group to take over and to present for people's also following and listening this live this morning. I'll only be sharing a bit of your slides so that others out there can be encouraged to consider maybe this computational bit. Okay, so the first group, please proceed. Is that Dr. Banita's group? Am I right?
Yes, Doctor. Yes. Thank you so much for the opportunity. And on behalf of my group, I would like to present Lydia. She will gonna present our progress report. Thank you so much, Lydia.
Thank you, Doctor.
So, colleagues listening this live, this is a fellowship program where I had that great initiative since I was a master's student when we were trained on in silico computational methods, and then I pulled all my colleagues, and then we started this initiative, and that is called Emt Cadda Fellowship Program. That is basically Emt is to mean just my initials, Ermias Margata Rafa. And then CADA means it is computational aided drug discovery, which is a computational and structural biology initiative to support Africa's drug discovery journey. So the first cohort has reached now to it is last journey. They are each of we have like 6 groups, and they have done their research work, and today they will be presenting their second progress report, and I'll be sharing part of their presentation shortly so that you can see it and you can be encouraged, maybe if you are out there. And I believe that will really help and motivate and encourage some science students, some high school students, okay, or university students. Even if you are doing your PhD, I think this is a good opportunity. You can integrate computational bit to your research. It really adds value to your work. If you are a master's student, this is a good opportunity. You need to be keen. You need not only joining this fellowship program. There was no payment for that. It is just a free training, completely free training, and the training was facilitated by quite a number of scientists from different parts of the world. So, but if you need to know more about what is computer-aided drug discovery, how can I better educate myself? How can I be on this? You can just reach out. Let me share with you some of the progress reports so that you can see.
Again, I'm excited to share our progress on this research title, that is experimental validation of Eugenia indica, looking at LC, MS, phytochemical profiling, antioxidant, anti-cancer, and molecular docking studies. Our focus, our key point in this research is to focus on this plant, the Eugenia indica, which has traditional medicinal significance. We are using modern laboratory techniques to scientifically validate its potential therapeutic properties particularly in cancer prevention and treatment. And on the overview of our project, I would like to a little bit walk you through the core components of our project. We are doing, or we have done comprehensive phytochemical profiling of this plant, identifying all the chemical compounds, using advanced LCMS technology to give us a detailed fingerprint of the plant's chemical composition. Then we are doing LCMS-based compound identification.
I believe, peoples, you can hear the audio. Can you tell me maybe on the chat if you can hear part of the audio? Is it audible? Can I get a response, please? One of you in the chat, you can tell me if you can hear this thing, what they are presenting.
We are also doing in vitro antioxidant activity assessment, testing whether the plant compounds can neutralize harmful free radicals, which is crucial for preventing cellular damage and aging-related diseases. We are also doing anti-cancer evaluation again of the plant against multiple cell lines, exposing cancer cells from different tissues. We know like prostate cancer, that's what we are doing prostate cancer, oral, liver, breast, and lung cancers to the plant. We are exposing the plant to the cell lines to see if they inhibit.
Lydia, sorry, can you put it on full screen, please?
Okay.
Thank you. Yeah. Yes, slideshow.
Oh, I do a slideshow?
Yes.
Okay. All right. It's okay now?
Not now. Maybe you can stop sharing and then you can click the green button. You see the share button. You can do it again.
So I start presenting first.
Yes, please.
Okay. Let me stop sharing.
Then what you can do, then now click the share button. When you click the share button, you will see entire screen. Do you see that part?
Yes, I see entire screen.
Yes, click that and click the share button.
Okay, I click entire screen and I share.
Wonderful. Excellent. Now it's okay. Just now go to your PowerPoint and put it in full screen. Now slideshow.
Okay. Thank you very much.
Excellent. Excellent. Thank you.
Thank you. I had gone through this. I was explaining this. Okay. Our what we are doing. I was giving a project overview. Thank you very much for that help. So I was saying that one of the things that we are doing.
So for those following this online, what we are doing is this is a progress report of our second computational research fellowship program, and it is just to encourage any of you out there, maybe one of you, if you'll be interested, you can reach out so that you can get the opportunity to be trained. There is no fee. You'll be trained on computational bit. Maybe this will help. But take time to listen to the progress report.
Now, we are also doing molecular docking studies for mechanistic insights using computational methods to be able to predict how the plant compounds are interacting with the cancer-related proteins so that we can understand their anti-cancer mechanisms at the molecular level. And our research objectives are as seen. We have goals in our research to achieve, which are our primary objectives. We want to identify, or we have identified and characterized bioactive phytochemicals in Eugenia indica. That's one of the objectives. In this, we are using modern analytical chemistry to discover which compounds in the plants are responsible for its medicinal properties. Our objective number 2 is to evaluate antioxidant potential using standard assays, the DPPH and the FRAP. Now, DPPH we do is a chromatophore, with a purple color cation, a radical, and it is decolorized by any antioxidant compound that donates to it an electron. So it is a good assay to help us establish antioxidant strength of our compounds. And the FRAP, that is the fluorescence recovery after photo bleaching, is also a good assay that shows the strength and validates the traditional use of.
Colleagues listening online, I believe the audio is fine. Please just listen. Especially, I believe this will be a great help for any of you who will be interested in computational drug discovery. So this is based on our fellowship program, which is lasting for like now 6 months, and they'll graduate very soon. So this is one of my community service initiative, giving back to the community, and we have quite a large number of people who are so interested, young ones, in building their knowledge and skill in computational research. So the first cohort will be finishing soon, being equipped not only with the knowledge, now they are translating that knowledge to an actual publishable research. Okay, so this morning they are doing that progress report, and I'm just inviting you, you can listen that. If any of you are doing science, medicine, pharmacy, biology, chemistry, if not, you can share this also to other peoples in your network so that they get benefit of it. Especially, it is so helpful in building your knowledge, skill, and also for those doing research. Also, it really adds on proving or answering your research question. So let me just, oh, sorry, thank you for that. Sorry, I was not aware that I was muted. So what we are doing this morning, we are doing a progress report. I'm sharing our progress report from the first cohort of Emt Cadda Fellowship. This is a fellowship program which I started last year in September, which is with the initiative to build capacity and skill of young students from high school all the way to PhD programs in computer-based drug discovery. As you know, drug discovery has gone nowadays to computers, okay, not only in vitro, not only on animals, you see, because that mode of drug discovery is quite intensive, quite time-taking. But now by using computers, it has become very easy to predict physiological effect, biological effect of drugs. Not only that, but also to predict side effects, toxicities of drug-like products. So I believe those of you who are doing basic science in university, from medicine, pharmacy, biology, all the other types of research, or even if you are a high school student, we can really mentor you. We can nurture that skill you have in computers. So you see, nowadays, the computers have become a big tool. Can you imagine that a drug could be discovered by sitting on a computer? So, but we have quite a number of new drugs that are coming to the market who are just being discovered heavily using computers. So if you are a master's or a PhD student, this fellowship program is wonderful. We have quite a number of people, more than 50, who are being enrolled, and today they are doing their progress report. Maybe you can let us listen to the ongoing progress report, and we'll be back.
In isolation. We have been able to look at them in isolation. Now, in yield, we calculated the yield using gravimetric analysis.
I believe it is
by
they are
measuring
audible. Maybe you can
exactly
hear.
how much extract came from the raw plant material. And this data was very important, and it's very important for scaling up processes in extraction of plant compounds, understanding the compound concentration. Then we stored all our extracts at -20 degrees centigrade.
I believe out there the audio is, I believe they are audible. So this group basically what they did is they blended Bose experimental research, wet lab, and computational. Okay, and you listen to their work. They have extracted a plant material that is a traditional medicinal plant, and then also they have isolated some phytochemicals, and they have also used computer-based drug discovery system. So I think that is a very good type of research. Please listen to them, what they have done. That is a very good research.
Ethiopia to separate the compounds and also to identify them with high precision and sensitivity. And then we separated, and in the separation techniques, to separate the compounds, we're using the C18 reverse phase column, which is standard. It's the standard for separating organic compounds, allowing us to separate many of them, all of them in a single run. Then we used the mobile phase gradient with 0.1% from the acid in water and acetonitrile. Now, this gradient approach changes the solvent strength, allowing compounds with different polarities to elute at different times, so that the separation can be better. We also identified the compounds. We matched our results against major databases, specifically the PubChem and Metlin. Now, these databases contain mass spectra and structural information for thousands of known compounds, as we have been taught in our lessons, and so it allowed us to identify what we found. We also did quantification, a peak area integration, gives us the quantity of each compound. So we're able to get the quantity of each compound, and by comparing against the standard compounds, we are able to calculate exact concentrations, which is very crucial for understanding the plant's chemical composition. Now, we also, next we did antioxidant assays. And in antioxidant assays, we did the DPPH assay, which is a stable, DPPH is a stable free radical. It has, when antioxidants are present, they donate electrons to this radical and causing a color change to yellow. And the degree of color change, that's the deeper the yellow, the more the antioxidant strength of the.
Maybe can someone tell me if the audio is clear, if you are able to follow the presentation in the chat, please?
Did the FRAP assay, which is the ferric reducing antioxidant power. It measures the ability of compounds to reduce ferric ion to ferrous ion, and causing a color change again. And it is complementary to DPPH, measuring a different aspect of antioxidant activity. We also did the total phenolic content assay using the Folin GeoCATU method. Now, phenolic compounds are major oxidants in plants. And the Folin GeoCATU reagent reacts with phenols to produce a blue color proportional to the phenolic concentration. So this method helps to quantify total phenolic content measured as milligrams garlic acid equivalent per gram. So that we did. And then we assess the IC50 inhibitory concentration of our compounds here.
So those of you who have joined late, what we are doing this morning is just I'm sharing a progress report presentation by the fellows who have been participants of the fellowship program called Emt Cadda. That was my initiative. The EMT is my initials, and then it is on computational based drug discovery. We currently have active near to 50 participants. We call them fellows who've joined the program and who've been trained for the last 6 months. Now the fellowship is coming to an end. Basically, the training focuses on the use of computers in drug discovery. So we'll be calling soon the second cohort, and if any of you out there are interested in doing research using computers, especially drug discovery research. Maybe most people usually do on isolating drugs from plants and testing it to maybe on animals. But we can provide you a support, technical support, and education support of no charge. We need really to build capacity of young people from Africa and even from other continents. In our training, we have participants from Nigeria, from Kenya, Ethiopia, India. So that is an amazing training. So feel free to join, feel free to reach out if you really need to know what does this computational research entail. So we're listening to the progress report this morning. I'll just bring the progress report back to you. Kindly, if you are interested on this aspect, kindly like this live video session. You can share the video session to your network. This is a live one. You can ask any question if you have when it comes to what is it in computer. You see, now everyone talks about artificial intelligence. So we're using a lot of artificial intelligence again for drug discovery. So what does that artificial intelligence means for a drug discovery pathway? If you need to know that, feel free to reach out. This is a moment where we can build skill, we can teach, and also encourage young researchers in that aspect. So imagine artificial intelligence now is not only ChatGPT, it's not about only all the others, but companies, pharma companies, drug manufacturer companies are heavily investing on that aspect. So our young people should be equipped with artificial intelligence, with computational research, in this aspect, because that is the future. So let me bring to you the ongoing progress report. This session is already live both on YouTube and on TikTok. Thank you, peoples, for joining. Kindly like this live session also that it reaches to many peoples, and also you can share if you have a friend or a family member interested in science, in biology, in chemistry. As young as high school students, we need really to impress them. Those doing their masters and PhD, you can send this link to them so they can be trained, and there is nothing they pay for it. Just we provide them that capacity building. Okay, let me take you back to the ongoing presentation.
The box, which is the
kindly confirm if the audio is clear.
Which is the executioner of apoptosis, and P53, which is like the guardian of the genome. It activates apoptosis in response to DNA damage. This target was selected because cancer cells often evade apoptosis, and therefore compounds that trigger these pathways could be very therapeutic. Now, for the docking software options we used were the Autodoc Winner, which in our lessons we have been told that it is fast, accurate, and it's an open source tool. The gold is a commercial software with advanced algorithms. We also use the Glide, which is part of Schrödinger's suite. It's very accurate, although expensive, but it's very accurate. Now, in docking, the docking protocol we used, now flexible docking with the genetic algorithm, it means that the ligand, which is our plant compound, it can adopt multiple conformations while the protein remains relatively fixed. So the genetic algorithm, explores different binding positions to find the optimal interaction. And the scoring function, binding affinity scores, indicate how strongly the compound binds to the protein, where lower binding scores show more negative, that is more negative binding energy values. They indicate stronger and more favorable interactions. We also analyze specific hydrogen bonds and hydrophobic contacts. Visualization, now PIMO and BioVia, that is what we use. Now, Discovery Studio allows us to visualize these molecule interactions in 3D, showing exactly how and where the compounds fit in the protein binding pocket. So that was our why we chose those docking software tools. And currently on Progress, up to date, the completed tasks.
Are we all together?
We have done plant.
Is the audio clear? Maybe can someone confirm? I can see few of you have joined. Maybe kindly confirm. Can I get a confirmation? Just one confirmation if the audio is good. And if you are encouraged, please share to your networks about this fellowship program. This is a program building capacity on computer-based drug discovery, okay? So the computational research is really gaining a big attention. So the computational research so it will really help quite a number of young people doing research. If you are doing your research, be it your first degree research, your second degree, or even your PhD research, there is a lot that computers can come in this space. Basically, this is for those doing in science, be it biology, chemistry, medicine, pharmacy. It really entails a lot. So what we are doing in this research, as you have followed in the ongoing progress report by this presenter, okay, they have tried to collect a plant material, and then also they have extracted that medicinal plant, and they have further done analysis, lab test, and also they have used a computational technique. That is what is saying about the protein target preparation. You see, that is why sometimes in drug research, if you do it only in wet lab, you'll be able to answer only one question, okay? But again, the drug discovery process will be too long if you just use one approach. So that is why, for purpose of triangulation, nowadays we really encourage people to also adopt the computational bit so that you can be able to answer more research questions. So if you are really enjoying this session, please just type your comment, or you can also give us a like button so that it reaches to quite a number of people. Can you listen? Let's continue.
Protein target preparation. Protein target preparation. We've done crystal structures of our target proteins. We have done crystal structures of our target proteins. That's the BSCL2, BAX, Caspase 3, and P53. They have been retrieved from the protein. Now, our LCMS analysis has identified 12 major phytochemical compounds in the analyzed fraction. And the detailed chromatogram is shown here, which is a structural chart of what the compounds are showing the base peak intensity against the retention time. And these compounds here represent the main bioactive constituents of Eugenia indica, our plant. Further analysis is underway to correlate specific compounds with observed antioxidant and anti-cancer activities. And a structure elucidation of unknown compounds is ongoing also using the 2D NMR spectrometry. On antioxidant activity, our key results is that DPPHIC 50 results with lower values, that is, lower values indicate stronger antioxidant. We have aqueous fraction, that is 12.3 plus or minus 0.6 micrograms per ml. This represents strong antioxidant activity, comparable to standard antioxidants like vitamin C. Total phenolic content, 195 plus or minus 8 milligrams garlic acid equivalent per gram. This high phenolic content explains the antioxidant strength. Phenolic compounds are known to be potent free radical scavengers. Now, the interpretation of this means that these results validate the traditional use of Eugenia indica as a health-promoting plant. Now, the aqueous extract shows particularly a strong antioxidant potential.
So those who join late, again, to give you just a highlight what is really going on. This is a group presenting on their research, on computational research. As I mentioned earlier, we've been doing a fellowship program on computer-based drug discovery. That is one of my community service initiative, where I started that initiative last year. I mobilized quite a number of my friends, and then we started this initiative. And now the first cohort is presenting their second progress report. Kindly listen to them as I will be explaining. So kindly like this video. Maybe if you are in science, if you have a friend doing science, biology, chemistry, please feel free to share this live session to them. That is very helpful.
Hello, am I clear?
Yes.
Thank you.
Yes,
Thank
you are
very
clear,
much.
Lydia.
Thank you very much. Dr. Banita had indicated that we are having a lot.
Yes, you are.
Thank you. Yeah, she had indicated that they are having a lot of activities in her campus, and so allow me to present on her behalf. I like she is able to. So we've come across some challenges and also come up with some solutions. One of the challenge is that the complex LCMS profile with overlapping signals. There's overlapping signals there. The problem is that when analyzing complex plant extracts, multiple compounds can elute from the chromatographic column at similar times. And this makes identification.
So the interesting part of research, you see, everyone talks about research, and remember that research is always to respond to a research question, to solve a problem. We don't do research just to share a knowledge. So basically here you can see people are using both wet lab and computer-based based drug discovery research method. So that is a great good thing. If you are doing science, you can try to apply this computational bit of research, and you can also reach out for any challenge you are really facing on doing your research project. We can provide you that support. But this is the beauty of this computational bit. It really helps you to answer. When I say computational, it's just the use of computers in drug discovery. Let us listen to the ongoing presentation and progress report.
In pH, serum, concentration, that's growth factors, or temperature can affect results. And the solution we have come up with is that we are systematically optimizing culture parameters. That's the pH buffering, serum concentration, temperature, and temperature stability. And this will ensure consistent reproducible results and also improve assay reliability. Then in science, we know that standardized protocols prevent variability between experiments. So the other challenge is the docking software installation and validation. The problem is that molecular docking softwares can be very expensive and very technical to install and validate for accuracy. But the solution we have come up with is that we will utilize cloud-based tools like Glide, as Prodinger Suite, and Autodoc Server. This will eliminate installation issues and provide validation algorithms. Now, being in diverse places, we are a group constituting of research fellows in different countries. So cloud access will ensure we can perform from multiple locations and collaborate effectively and be able to deliver our targets and our objectives within the specified time. Our timelines and milestones, we are in January 2026, which just ended. We intended the work that is already complete. Currently, LCMS analysis is complete, antioxidant assay is completed, cytotoxic studies on all cell lines are completed. And this February, which is our next phase, the current day, we intend to finish molecular docking studies completely, data analysis and statistical validation between 5 to 7 days. That's what.
So in summary, colleagues, in this live session will end soon. So what we've done is the intention of this live session is to brief you on our Emt Cadda Fellowship Program. Please Google on it, Emt Cadda. I'll just add it on the comment section later on. So watch out if you have a colleague or if you are doing a research on drug research, especially with regard to if you are a science student, if you are in medicine, in pharmacy, then I think this is a good opportunity. You can embark, you can join our fellowship program. We'll be sending out the call sometime in March, and maybe the second cohort will start in April, but I believe that will be very helpful. So thank you all for joining the live session. Please like, comment, and share my videos, and thank you for joining me this morning.
Products, phyto